etc. Okay, yeah, just letting people file in. Because we're starting early, which perfect example of compliance, right?
To be the first. We always like to be the first.
All right. So I'm going to give it like 2 minutes to like a few minutes after that, and then I'll start just kind of let people file in. I can see them kind of hopping on.
Can I ask you a quick question? If one of us has to step out for a second for
That's fine.
ladies' break, will we
Yeah.
disappear?
Just disappear.
Okay. Normally I can, stop video, but I can't see that control. Oh, I can. Oh, that's how we can do it.
Okay. Okay, so I'm just going to start to kind of give some directions, quick introductions and whatnot. But I'd like to start with a quick disclaimer at the beginning here. Please understand that nothing that is answered by any of our panelists should be considered legal advice or counseling. The responses to questions posed to us are from the most current available resources on the web. So this is going to be from the Society for Human Resource Management, which is also known as SHRM, CDC, OSHA, WHO, and local public health departments. These are the primary resources that we reference. Some of the information from CDC has been contested. We're aware of this, but until updated material is published, we're going to utilize what's currently out there. We also want to thank everybody for all the questions that we got ahead of time. Those questions really did help us in actually providing some takeaways and things like that are free resources. I will post that link in the chat box and also on Facebook, so that if you want to go and grab those. Now, a good number of you guys are already clients, so most of you have a lot of the takeaways and whatnot, but if for some reason you don't, please just go to the client resource portal. All right, so let me get back here. And I'm going to do my best to keep up with the questions. So if you guys would like, anybody who's on, there is a place at the bottom of your screen that you can pose your questions. It says Q&A. We also have the chat box where you can pose your questions. So if you want to do either of those, feel free to do it, and I'll put those in the queue. Same thing goes for those of you who are on Facebook. If you want to just write your comments, I will be happy to try to keep up with those. So let's start with a quick introduction then. My name is Alicia Mahoney. I'm the Chief Operating Officer of Business and Clinical Management Services, better known as BCMS. We are a compliance consulting firm, and we've been in the compliance world specifically since 2000, but we've been a physical therapy practice at one time since 1985. And this is what we do, outpatient physical therapy compliance. So panelists today, the first is Mary DeLong. She's our president and CEO. Mary has had quite an experience, a lot of experience over 4 decades of being a physical therapist. So thank you, Mary.
Actually, she's 5 on August 28th.
And there you go. So Mary will be answering the majority of the COVID-related questions, so just so you know where that's coming from. We also have Seal Stokes, who is BCMS Chief Auditor. For those of you who have never gotten to meet Seal before, she does all of our offsite chart audits. Seal also has had a long term duration as a physical therapist, not quite as long as Mary's, but she's just, has some great experience under her belt, and so she's going to be answering the questions related to audits. A lot of you saw that OSHA audits started, and now some of the other audits coming back from Medicare are happening, so we'll kind of address those with some of the questions. And last but certainly not least is Teresa DeLong. She is our Vice President of Human Resources and Special Compliance Consulting Services. She is our HR guru. So obviously she will be answering all of our HR questions, and I know a lot of you who are our clients are very familiar with her. HR is her jam. So with no further ado, I'm going to go ahead and start the first question, all right? First question is for Teresa. For employees with school-age kids, if they are not able to work their scheduled hours due to children home from school for remote learning, is this expanded FMLA leave of up to 12 weeks required to be paid by the employer for the full 12 weeks? If so, is it recommended to code the leave? I'm assuming FFCRA leave past 10 days would not be coded.
Yeah, so the Families First Act, so FFCRA, does cover leave as one of the options for your employees who have to be off to take care of children whose daycare or school is closed for coronavirus. So if their school is not open and they're having to homeschool because of that, they would be eligible for up to 12 weeks at 2/3 their pay while their kids are not in school. This can be intermittent leave though, so keep that in mind if they're doing a blended learning for their school. Some of the districts are doing that right now where it's like 2 days in person and 3 days at home. The days at home, they could use leave for because they have to manage their kids, but the 2 days that would not be covered for leave because those kids can be in school and the school is not closed for those 2 days. So it'd be an intermittent leave, 3 days under the leave, 2 days under their regular pay. So you can use the FFCRA and it is designed for that to help all those parents whose kids are now at home or doing virtual school or doing some sort of blend.
Okay, and also, sorry guys, meant to tell everybody, we are recording this. So, and it will also be on our Facebook page. So at any point, if you want to go back and watch anything, it'll be there. All right. Okay, so next question. If I was given a TPE that was canceled during COVID, and this is for you, Seal, does this mean that my NPI number will always be under a microscope? Is my clinic that I own marked for death regarding future audits?
That's a great question. We know that during the coronavirus pandemic that all the TPEs were suspended, and so some of our clients were definitely breathing a sigh of relief during that time. And at the time of this webinar, we do not have an anticipated date available in which they would be restarting those, but we do anticipate those to be coming in the future. Most of the time, your clinic or your NPI number would not necessarily be targeted for future TPEs. If you take the information from the educational probe audits and put it to use and improve yourself, and as long as you are being compliant with your billing and documentation requirements, then you should not necessarily be a target for future audits.
The rest of
Awesome.
it.
And Seal, I want to follow up with that question. What are the top 3 reasons that you feel TPEs are given in the first place?
Well, there are several, more than 3 probably, but the top 3 things would be aberrant billing, potentially billing more units in a day than your peers, being able to have a focus on modalities that are greater than, say, 20% of the total case. Those would be some examples of that. So, or even potentially over seeing patients longer than necessary, medically necessary, either with for the KX modifier purposes or not seeing them long enough. So there were some indications that we're seeing in those areas as well.
All right, thanks, Seal. Okay, so the next question. A coworker had symptoms of COVID and tested negative. Is there a possibility that the test was a false negative, and should I be concerned?
Well, we're always concerned, but if the person is concerned about their exposure was wearing proper PPE, then they shouldn't be overly concerned. That's the big question. You know, if you were in most of the time PT, we are in close contact. So we do need to wear the proper PPE, and we're not talking about cloth masks. So if they're negative, the employer probably should have told the employee or the patient, whoever was the source of the exposure, to self-monitor, as well as they should be doing the screening. The same thing for the person who was in close contact but wearing PPE.
Okay, thank you, Mary. So this question has actually come in a number of different people have asked this question, and so I'm just going to simplify This one goes for Teresa. Do I have to pay my salaried employees overtime?
Great question. Happens almost every single day. So salaried or hourly are ways you pay your employees. So how you're choosing to pay them. Federal classification for employees, whether they are exempt or non-exempt, is different from salaried or hourly. So first you need to look at how they're classified. Is your employee an exempt employee, meaning they are exempt from having to pay them overtime for the work they do? Or are they non-exempt and eligible for overtime, so meaning you pay them for every hour they work? There are a ton of different categories to decide if someone is exempt or not, and there are 3 pieces that must be in place before you choose to say my employee is exempt. The first is, do they meet one of the criteria? And there's 5 of them that you can kind of choose from, but the 2 you see mostly for physical therapy clinics will be the professional, which is where your PTs lie. They're licensed professional staff. And administrative, you can have office managers or some people that have additional responsibilities that qualify under those conditions. So you need to look at those kind of criteria first and see if your employees, based on their job duties, and I don't care what you call them, because I have office managers that literally just answer the phone, and I have office managers that manage 7 people and run the entire clinic. So it's what are they doing as their job, and see if it meets the criteria in one of those categories to see if they might qualify as being exempt. If they meet the category for one of those, then you can look at how you're paying them. Am I paying them the same amount of money every paycheck, no matter what? Then you have to look at, am I paying them above the federal level for salary? So in this case, it is $684 a week right now for the federal cutoff to be exempt. You guys do need to be aware, though, that some cities and states have higher minimum wage numbers, which means that 684 number is actually higher in those locations. So depending on where you are, California, some places in New York City, some other states that have considerably higher minimum wage requirements, that 684 number will actually be higher. So they have to meet all 3 of those to be considered exempt. So they have to meet one of the criteria that says they can be exempt. You have to pay them the same amount of money every week, no matter what. And then you have to pay them above the threshold, which right now is 684 at the federal level. The exempt employees don't get overtime. They make the same money, whether they work an hour or 65 hours in a week. If they don't meet all 3 of those, they are non-exempt employees, which means they are paid for every hour they work. So then they get overtime. So if you've got employees that are working 42 hours a week, they get 40 hours of regular pay in most states and 2 hours of overtime. You also need to be aware, depending on where you live and what state you live in, that overtime sometimes has a daily qualifier as well. So California, Arizona, Alaska, Colorado all have some different ones. So if you're in one of those states, be aware. You may be 8 hours in a day or more as overtime, or over 12 hours in a day. So check your local Department of Labor so that you know where that cutoff is for the overtime hours, either in a week or in a day. But you can choose to pay your non-exempt staff a salary and say, you know, they're going to make $56,000 a year. Then you're going to divide that back to get their hourly rate so that when they only work 37 hours in a week, you know what to pay them. And when they work 42 hours in a week, you know what to pay them. Oh. So the salary piece is tricky because salary is just how you pay someone, but it doesn't fix their category from are they entitled to overtime or not. That's where exempt and non-exempt come in.
Awesome. And just as a follow-up, we have so many clients who've asked this question that we did create a webinar that we sent out in SIPA. If you didn't see this, if you go to our client resource portal, it is on the homepage ready to view. So everything Teresa just said, you can get reiterated from that webinar. All right, thank you, Teresa. Okay. All right, this is a Mary question. Is it true that the CDC has changed the quarantine time for healthcare workers returning to work and for patients returning to therapy to 10 days?
Well, yes. And this is where people say, that's not what I heard. Or you have other people contesting whether this is the most current information. But yes, they have changed. And one of the things I want to bring forth first is there's isolation and there's quarantine. Isolation is really to keep sick people, whether it's COVID or whatever, away from people who are not sick. And quarantine is the restriction of movement, or it's just you got to stay in your house, but you could be around people possibly who might have been exposed to a contagious disease to see if they become sick. And if they don't, then they don't. This changed because at one time they were using the test-based strategy to determine whether somebody was ready to return to work or to therapy or whatever, to be out of quarantine or isolation. And they found that because people can carry the virus and not be infectious, they still might get a positive test. So they'd be home or isolated for, unnecessary time. So that is why they changed to symptom-based. The problem that we have is when they did the 10-day period, that was really for people who had mild to moderate symptoms. If someone had really serious symptoms, life-threatening symptoms were, isolated in the hospital or something of that nature, we're looking at up to 20 days and then with consultation. So if someone goes into isolation, the 10 days is the point where they think you're no longer contagious for the mild to moderate. But you also have other factors. You have the 24-hour consideration without fever, without medication to control the fever, and that the other symptoms, if they had them, were resolving. If someone didn't have fever, and one of the things we know, and actually I just found this out maybe a year ago, is that people, senior citizens, I don't know if I fit that role, but anyway, the people that are 65 and older often do not have fever when they have infections. And so they may not have a fever and still be infectious or infected. So you have to look at other symptoms. Now, what happens to the person who is asymptomatic? Well, they get thrown into the 14-day quarantine period because they don't have symptoms to go by. So unless they go and get tested and have a negative test, right now, the recommendation is 14 days if they have been in close contact with someone without PPE.
Okay. Thank you.
So now you see why it's confusing.
Yeah, I know, right? Okay, Seal, this is so funny. This one was emailed last week, but then another person literally asked me this question yesterday. What should I do if our company performs internal audits and one of the therapists doesn't like or doesn't agree with the findings?
Yes, we do hear that comment quite often, and it's one of the, we typically would commend the organization for doing internal audits in the first place, and hopefully they are gathering information and helping to drive, improvements within their organization from those audits. And so it can be a little contentious situation at times where, the person doing the audit ends up feeling like the bad guy. And, this is a situation where we here at BCMS could step in and perform an outside audit for you. And then we look at it as an independent third party, and we would evaluate the documentation and billing based on either the payer requirements or Medicare requirements or whatever the situation would be, and then submit those findings to you in a way that would be hopefully well received and give you some more resources to support the findings, and then that information may be coming from us versus from you.
Okay, and while I have you talking, Seal, if you did get an audit from a third party, how would you use the information that's identified in that audit for your practice? Like, what are the benefits of doing one of those?
Well, there are several things, and I kind of would start by saying, we use metrics and benchmarks in all aspects of our life, and so looking at an audit in that way kind of tends to make sense. I mean, we measure patient progress all the time with our objective tests. We measure our outcomes based on other peers or standards of practice and things like that. We consult with our accountants and attorneys to get, the best processes for balancing our checkbooks and, processing that information. And so when we're looking at the audit, it's a way to kind of benchmark your your documentation and billing practices in a similar way that you would when you look at your profit and loss statement or something like that. You get the information that says, well, here, number one is my risk. You know, do I have any risk in any of the way that or there are trends in the way that my practice is documenting that shows that I may be on the radar screen, or certainly we have these pressures every day that we've got to see these patients, but we also have the pressure of making sure that our documentation and billing is supported in order to be paid properly, because we certainly wouldn't want to be in a situation where we could create some sort of fraud, or abuse situation as well. And so then by getting that information from our outside audit, you're able to set up either action plans, or educational opportunities. Once you identify any deficiencies that you have in your documentation, you're able to set those up such that you could use them to help to further along your training processes with your employees and education. And then we have many of our clients that have used the audit situation for performance reviews, for their career tracks, and also for incentive programs if someone does well. So, we feel like it's a very proactive way to approach this. It creates sort of that internal culture where compliance is important, and then everybody's being assessed in that way, and then using that information to drive change and to only get better. I mean, that's what you did in PT school. You didn't perform well on a certain technique or something like that. You had to practice to get better at it, and you learned it, and you went to get further education in order to get better at those skills, and documentation and billing can be the same way.
Thanks, Seal. Okay, next question is a Mary question. Are we required to report COVID-19 exposures or confirm COVID-19 diagnosis?
Oh, we sure are. The OSHA standards require us to report illnesses and injuries. We have a requirement to comply with the general duty clause, which means you are providing people with a safe and hazard-free environment. Now, we try everything we can, but we can't keep COVID out of our everyday environment, our work environment, that type of thing. But if there is a serious illness or injury, we do have to record that. We record it on the OSHA 300 form. Physical therapists, occupational therapists, speech and language pathologists are all in a partially exempt status. In the past, and that was a long past, I'm gonna say in the 80s, maybe even early 90s, we had to post a OSHA 200 and 300 form, OSHA 200 form that listed all those things that happened that were serious injuries and illnesses. And when they made us partially exempt, they said, you don't have to post that anymore, but you still do have to record. So yes, we do. And the other thing we highly recommend is that you maintain a record of these things, people that have been exposed, patients who have been exposed, those situations in an incident report as well.
Okay, so thank you very much. Okay, this is a funny one, Teresa. During this relaxed time, because of Zooms and just getting by, some of my employees have started to push the boundaries on the dress code. Can I have a dress code policy that prohibits tattoos or piercing or hair color styles, etc.? Okay. Teresa? I think, Teresa, can you hear us? I think, hold on, she's calling back in. Her call just dropped. Sorry, everybody. Okay, while she's doing that, I'll go to a different question. Let's see, Seal, yes, we saw on Facebook that someone had an OSHA audit a couple of months ago. Are these still going on, or are other audits happening now?
Yes, the information that we're seeing right now is that, as I mentioned earlier, is that the targeted probe and education audits are going to be scheduled for some time in the future. They're not going on at the moment. We are seeing audits that are considered more some post-payment and desk type audits that are happening right now. I think the sense is that they're still trying to let practices get back to baseline as far as recovering from the coronavirus, breaks in practice and things like that. But we are seeing some of the additional documentation requests and things like that that are coming in, or we call them ADRs, where they might request specific dates of service or specific types of information. And we definitely have put together a packet of things that will help you to organize for those if you are to receive an ADR. And that's one of the resources that will be in the links that Alicia will let everyone know about. So, but the main thing is to be diligent in making sure if you get an advanced documentation request that you do everything from save the envelope, save the letter, read the letter, provide the information exactly as they want it, organized fashion, because one of the things that we have heard from all of our clients that have actually taken the time to put their packets together in an organized and a well-meaning way is that the auditor tends to give them a little bit of consideration for that, in that, you know, we get some positive feedback is that if it's put together well, it's put together organized, and it's getting them the information exactly that they need, then that is being much more well received.
Alicia, I'll speak to the OSHA portion.
Yes.
Okay, as far as OSHA, the things that we have seen is that the OSHA surveys, and they indeed have happened, have come because of complaints. The complaints primarily have originated with employees saying they have a hazardous environment. So this again is another reason that you want to really comply with all of the things we're supposed to do: social distancing, wearing proper PPE, all those types of things. HIPAA, looking at the OCR's website, they're kind of getting restless because they still are under waiver. They haven't taken the waiver away that allows some flexibility, especially in some of the security areas. But they expect it to be, if you know, you cannot disrespect the patient's right for privacy. So I think we'll probably be seeing those pop up.
Okay. That's what one of our clients definitely had that happen. So I'm going to go back to Teresa to the question. During this relaxed time because of Zooms and just getting by, some of my employees have started to push the boundaries on the dress code. Can I have a dress code policy that prohibits tattoos, piercings, hair color / styles? All right, let's go there.
So, yeah, we can go there. You know, because your Zoom meeting, your pajamas with your fuzzy hat, you know, may or may not be as professional as you're hoping for if they're doing, you know, televisits with your patients. Yes, you can actually have a policy that prohibits piercings or tattoos. Hair color or hairstyles is a little different, and I will talk about that in a second. But if you want to have a dress code and prohibit piercings or tattoos, that's fine. The key is to enforce it uniformly for everybody, so you can't pick and choose. So if you say no piercings, that means no one gets any. You can have a policy that says earrings only, but that means anyone can wear earrings at that point. So you can't pick and choose who gets to wear earrings and who doesn't. So, you know, if you're thinking earrings only, and I'm fine with the women wearing earrings to work, that's not how that policy is going to work. That means anyone can wear an earring to work if they so choose. Same with tattoos. You can't say some tattoos are okay. Like, you have a tiny tattoo on your wrist and I'm fine with that, but you can't have an arm sleeve. You have to pick one or the other and then enforce it uniformly across the board. Hairstyles and gets into an interesting place. There are several states now that have legislation that protect natural hairstyles that are tied to culture. So there used to be people that had policies, for example, like no dreads or no cornrows or things like that. That is no longer allowed. So you can't do that. You can have a policy that says hair color can only be a natural color. So you can keep people from having, you know, blue, green, purple hair at your workplace. But you can't, you know, that's a thing for you in your area. But you can't prohibit hairstyles and hair textures and things like that that are native to other cultures and things like that. So, you know, state laws have put a lot of that in place under their anti-discrimination piece. So you have to be very careful if you're getting into the hair piece.
All right, thank you, Teresa. I just wanted to circle back to some of the Q&As that were inside of because they kind of related to other answers. One, are PTAs considered exempt or non-exempt?
PTAs generally are considered non-exempt by rule.
Okay.
As most PTAs don't have any decision-making authority, so they're not going to meet the criteria to get an administrative or a professional exemption. You can give them other job duties. So if they supervise other employees, they are your compliance or HIPAA officer, and they have some oversight responsibilities. So you give them additional duties that would allow them to be exempt under the administrative piece, then they could be, but generally just as a PTA, they are non-exempt.
All right, thank you. And then I believe that this one is coming from Mary, the question that or comment you had done earlier. Does this mean that a therapist that returns from their vacation out of state has to quarantine?
Oh, we love that one because I got a jillion calls that said, I heard there's no more questions about whether you have to quarantine. Alicia, I think you just experienced that, didn't you?
I did, yes.
When our grandson came from Texas and went to New York, that was not a good thing. Yes, they are still enforcing it to a degree. Okay, there's so many hot spots. You have to look at local or state or jurisdiction requirements. CDC is still saying if you were exposed, then you're going to follow these things. If you were potentially exposed, then it's really going to depend upon what the local or jurisdictional public health department recommends that you do, or some mandate that you do.
Okay. Thank you. Okay, so
and let me add one little point. Of course, I always have to do that. I'm sorry, but again, where they went, were they out partying on the beach with 5,000 other people? Were they in close contact? Was this a small family gathering? All of those things are questions that are legitimate, and that would make a difference as to whether you felt that they had to quarantine. If they went to a celebrity's wedding and it was, jam-packed, you may have a different position on whether they need to quarantine or be tested.
okay, thank you. So this one is, I'm not, it's probably both Teresa and Mary. So let's start with this question. If an employee gets sick or has any symptoms like 8 different times this winter, do they get the 10 days off for self-isolation each time? Do they get paid for those 10 days each time?
Teresa probably has a longer answer, so I'm gonna answer quickly. First of all, if somebody is sick 8 different times, well, let me go to the scientific answer first. Only one case so far that has been reported, and it's from China, is that there has been a reinfection. Okay, so the fact that this person has had 8 different episodes of symptomology would lead me to believe that they've got something else going on. You could ask them to go to their physician of choice to determine whether they have some other issue going on, and that needs to be determined. But most likely it would not be COVID 8 different times in the winter or in any period of time, because that's just not what science is revealing right now.
All right, Teresa, do you have anything to add?
Gone again.
Oh man.
Nope, sorry, I left myself on mute. No worries, I'm here. So do they get paid every time? If they have sick leave, obviously they're off for being ill. They could use sick leave till it's expired, they don't have any more. Under Families First, they get up to 2 weeks total. So if they use their 2 weeks and they quarantine for COVID early on, there's not any more. It's not a recurring 2 weeks. It is 2 weeks period. End of story. So if they use 5 days the first time, they'd have 5 days left. For example, if they were a full-time employee. It's obviously prorated if they're a part-time employee because it's based on what they work in a typical week. So you get 2 weeks paid. So that's it. Also, just kind of a note on that, right now, Families First expires December 31st of this year. It has not been extended. So those protections will not carry over into 2021 unless they amend the law as it stands.
Okay, awesome. Okay, so kind of to build off of that, I'm kind of inserting some of the questions that weren't up front. Can you actually ask an employee about what they did on vacation to be able to determine if they have to put themselves at risk?
Yes, you can, and this is something that is set forth because of the pandemic. There certainly are restrictions in a non-pandemic situation, and obviously you couldn't use the pandemic to ask them questions that weren't related to a potential COVID situation, but you may ask them to make certain that you are complying with your duty to protect employees and patients and others around them. So yes, you may.
Okay. Okay, and another one here is, can we ask our staff to get flu shots?
Who's that to? Me? Okay,
Sure.
There's vaccination requirements. One that is an absolute to be offered to employee at no cost is hepatitis B. Certain states, like when we had, I call it Heine, but it's H1N1, the Heine issue, they, in one of the states, they were requiring vaccinations. So again, some people might have a reason not to, want to be vaccinated or whatever. They probably have to consider that if it's religious, health-wise, whatever. But unless the state requires it, I don't know that a facility can, but I cannot absolutely speak to that. What I would recommend if someone wants to enforce a policy like that is to contact the public health department or their licensed healthcare practitioner, who really should be the person that you deal with. And that's a person that's required, through OSHA under bloodborne pathogens. So that might be a good question. Can we do this? And should we do, and what reasons should we do it? And explain to the employees that type of thing.
Can you explain a little bit more of what a licensed healthcare practitioner is?
Oh, yeah, we'll have a long job description, but licensed healthcare practitioner is a requirement under bloodborne pathogen that you have an individual who has expertise, education, credentials that deal with infectious diseases, and their knowledge of bloodborne pathogens and other infectious diseases have to be there, and this person would be used to evaluate any request to be exempt from like the HPV vaccination. If there was an exposure, they would be the person that would be involved with pursuing prophylactic care, arranging blood tests. I know that I used our licensed practitioner when we had a situation that occurred in our clinic. We had a patient who had Epstein-Barr, and we had 3 employees, and we only had 6 PTs. We had 3 PTs pregnant. Their pediatrician said no, they could not treat that patient. And so we brought in the licensed healthcare practitioner, and she said, under these laws, there should be no reason to consider them exposed. We chose to go with the pediatrician's recommendation. So you can bring them in, they bring the law forward, and then there's a decision that has to be made. Obviously, you need to think about the consequences of a poor decision. But they are there, and that is a requirement that you have that person. They don't have to be on staff. They can be contracted. They can be an infection control nurse or doctor. They can be a public health official. We used our family practitioner. He was an incredible diagnostician. And so we used him, and he was readily accessible. So, but you do have to pay that individual for their services. They often are involved in helping you develop policies that could relate to infectious diseases and those things.
How did, and again, somebody just asked the question, how do you find one? Is there I know, it's like one of those things where And this is, I know, it's a question that like we actually get asked quite a lot.
We
so
do,
that
we do. So like I said, we used our family practitioner, and he happened to be in the building where we had our clinic. Many times you can use the instructors from colleges and junior colleges who teach infectious diseases. You can utilize infection control personnel from the hospital. A lot of times they'll contract. You're not talking about a heavy demand of their time, you know, unless it were COVID maybe, but I mean, in normal situations, you're probably not looking at more than an hour or 2 or 3 a year.
And does this apply to like small practices, like less than 50 people?
Yes, this bloodborne pathogens applies to all healthcare practitioners who have the risk for being exposed to bloodborne pathogens or other infectious materials. There is no time frame now, unless you're a sole proprietor and it's you by yourself.
Okay, and I'm just going to the sound froze for a second. A licensed healthcare practitioner does not need to be on staff. They can be contracted, and it's typically like a couple hours a year, etc.
So they would participate maybe in helping you formulate policy if you needed something specific to your clinic, to again be there for consultations with employees, maybe work restrictions. Now, COVID is a totally different thing, but in a normal thing, you know, somebody, let's just say, had rubella, you know, it's a work restriction. So, and maybe somebody's contesting it, or maybe there's an issue. So that's when you bring that person in. But they're not typically utilized heavily. They would be the person that would be ideal to conduct your annual bloodborne pathogens education. They're not required to do that. If you're a rehab agency, you are required to have an infection control committee. They would be an ideal person to be the chair of that committee.
Okay, thank you. That one kind of had some links to it. Teresa, does the FFCRA apply to employees in their 90-day probation?
So yes and no. Yes, if they have been with you at least 30 days. The FFCRA applies to any employee that has been with you 30 calendar days. So they may not have completed their 90-day probation, but if they've completed at least 30 days, they are eligible for leave under the FFCRA. The FFCRA also applies to businesses under 500 employees, so keep that in mind. There is an exemption for small businesses under 50, but it is not well documented, and you have to be able to prove that you providing that leave to your employees would jeopardize the viability of the small business. And there's a number of criteria in the FAQs that the Department of Labor has up that you have to meet. But it's a big financial reporting that you have to be able to show financially that you're not going to make it if you provide that leave if you're under 50. You don't have to submit the paperwork to the DOL for approval, but you do have to be able to prove it if it's questioned. There is not a lot of guidance out there for that exemption because the Department of Labor is encouraging people not to use it.
Okay, awesome. Thanks, Teresa. I'm going to hop back to a couple of our ones that were already in queue. And then I see a couple that are hopping in other areas. Okay, let's see. If a patient has let us know that they tested positive and were contagious when they were seen, does the employee or therapist need to self-isolate for the 10 days, or can we go off their COVID test with returning to work?
Okay, as I said, COVID testing is not the recommended method of return to work determination. But the real question is, was the person compliant with proper PPE? If everyone had to be restricted from work because they were exposed to COVID, the hospitals would be shut down because they're treating COVID patients. So the issue is proper PPE. And whether when they could socially distance, are they, you know, utilizing proper hand hygiene, all of the things. The questionnaires are so important to the screening questionnaires that you ask the patient and all that. So when all that's in place, no, that person should not have to be quarantined, they wouldn't be isolated because they have no symptomology and they haven't been diagnosed. But they shouldn't have to be quarantined just because the patient called and said they were positive for COVID. You have to look at all of the factors.
So we had another question that actually leads to that one. Do PTs and PTAs have to change out of their PPE after each patient visit?
No. Okay, so boy, we don't want to get into masks today because that will just take the rest of the afternoon. But there has to be reasonability. If you're working with a known COVID positive patient, absolutely. But most of our clinics are not seeing COVID positive patients purposefully. Now, we could have exposures, but in the normal situation, we are not dealing with those. We are trying to prevent, passing it on or getting the virus. So proper PPE is critical. And we really do encourage KN95 masks for our PTs. They are a little more expensive than the medical masks, but the KN95 masks do protect the wearer, whereas the medical mask does not, and certain cloth masks do not protect the wearer. They protect the others out there. So to get back to PPE, if it's a known patient, yes. If it's contaminated, or if you've been handling it, or if you haven't stored it properly. And by the way, store it in paper or cardboard, clean cardboard containers, not in plastic, because COVID lives less than 24 hours on that material and much longer in plastic.
Okay. And just to kind of build off of that, do we need to document that the patients are screened every visit, or is it enough that the company protocol that it gets performed?
I would tell you that it would be smart to keep a log, and it could be a very simple thing. You can do it on your schedule, maybe have a little color code that means you ask the question. You don't have to hand them a screening tool every time, but you do ask the questions. And you want to do that for your employees twice a day, if at all possible, so that you are showing due diligence for that. And that would include your contact-free fever testing.
Okay. Seal, this one's for you. It's from stuff that was in the queue already. This one was, somebody said, I heard about focused audits. What is that about?
Well, I think BCMS uses those focused audits. Maybe it's a term that we like to use, but it would be, for example, a clinic, whether they did internal audits themselves or whether we did a third-party audit for them and we identified certain findings. And then, as I mentioned earlier, you could drive, some action plans. So let's say, as an example, we identified that you had problems getting your plans of care signed in a timely manner or something like that. Then a focused audit could be set up internally where you as a clinic could pick a month. They say the next month, okay, we're going to randomly pick 10, 12 charts and we're going to check to see that we all had timely plan of care. So that would be considered a focused audit. And then you could pick different things depending on what the priority items were that were identified in the initial benchmarking session, or your own internal audits of any deficiencies that you had. And so you could use those information to drive those action plans and then demonstrate to outside payers as well as to CMS that you have an active compliance program going on and that you are actually working to proactively improve yourself. As once you've identified any potential problems or deficiencies, then you're addressing those with future audits as well as training opportunities.
Thank you, Seal. All right, this one's from earlier. I have a PT student on their last affiliation. She has 2 clinical instructors. One of them was off on vacation for 1 day. The other clinical instructor was supervising the therapist who treated and evaluated patients. The clinical instructor of course, signed off on the students' treatments. Our billing manager says that we cannot bill for those treatments as they were performed by the students. Is this true?
Well,
Mary?
it depends upon whether that was a Medicare patient or not, or a federally funded patient, because students do not have the right to bill, and there is a direct contact requirement to with students and the therapist. So the therapist cannot be doing anything else. They can't be writing their notes. They can't be treating another patient. They need to be supervising or performing, and the student can watch, but that they could not bill under that circumstance. If it is a commercial patient, unless the policy for that payer states that students are not permitted to bill for services, then the State Practice Act usually prevails. And the Practice Act does let, in most situations, does let the student treat patients under on-site supervision.
Okay, thank you.
Mhm.
Okay, so let's see, what's the next one? Okay. This one was kind of like a second question, Teresa, from earlier when they were talking about the policies on 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 piercing and whatnot. How do I roll out policies to a staff? And can I have my employee telework while they're at home with their children? Maybe start with the second one, or sorry, I'm just reading exactly what we're doing.
Yeah. How would you roll out the policies to your staff? So if you were going to make a change, or you wanted to roll out a new dress code policy that said, going forward, we're going to, no piercings or no tattoos or whatever it may be. Obviously, you want to have it in writing. Date it, put it in writing. I would share it with your staff. And this is kind of a best practice. This isn't like a rule that it has to be rolled out this way. It's sort of a best practice for rolling out something new. I would share it with your staff. They were going to have a staff meeting about it, so people have the opportunity to ask questions. It can be a short staff meeting. This is a short policy, so 15 or 20-minute staff meeting on whatever day. This is your opportunity to ask questions. If you have questions that you don't want to ask in the public forum, here's the contact to ask if you want to ask questions before the meeting. At the meeting, answer any questions, explain why you're doing it, because the why matters for folks. Some people don't understand, well, why does it matter now? Why are we making this change now? So be sure you can explain, why you made that directional change, and then have everybody sign off on the new policy. And then from that day forward, it's in effect, and you have to hold everybody to that same standard. Your policy will be completely ineffective if you don't enforce it. And the second you start letting things slide, that becomes your new policy, because you've made an exception and now everybody gets to have that same exception. So keep that in mind when you're doing your policies as well. Be consistent in enforcing them, because when you let things go, that becomes your new policy, whether it's in writing or not.
Another point to consider, oh, I'm sorry, Teresa, I didn't mean to interrupt.
Oh, go ahead.
Another point to consider is when we're talking about telehealth and people are just trying to think about how they're going to make it work because they've never done it, HIPAA comes into play. HIPAA has relaxed some of the platforms and whatever we're able to use, as long as they are not over the open internet. But they have not relaxed the fact that you cannot compromise the patient's privacy. So if you have a menagerie at your house and the patient's being treated telehealth, you're going to have a release in there that that's okay. The patient knows that all these people are here, they're hearing what's going on. So don't forget that. That needs to be included in your behavior policy.
And then just to kind of follow up, just if you have employees teleworking, which is a great way to kind of, for people that have to quarantine or people that have to be home with their kids, so they're splitting their time, they're going to telework half the day, and then they're going to supervise their kids' school for half the day, for example. They're teleworking for 4 hours, and for 4 hours they're supervising their kids. Those 4 hours are kind of back to that intermittent leave where they have to manage their kids because their school is closed. So they would be eligible for the FFCRA leave for those 4 hours, even if they were teleworking for half the day. So keep that in mind. The Department of Labor is very much encouraging flexibility in using that leave. And if people can telework for part of it so they don't have to be off the entire time on leave while their kids are not in school or at home school and you're having to supervise, they are very much encouraging employers and employees to work together to find a schedule that allows for some of that flexibility if that works with what their job is doing. Also, a thing to keep in mind that pay for employer or your employees while they're off on that leave for their students being home is only 2/3 their regular paycheck. So it behooves them to work as many regular hours as possible because that will be at their regular pay versus leave that they're using is only 2/3. And they are not eligible for unemployment while they are on FFCRA.
Oh, that's. Leisha?
Alicia, you're on mute.
I think you're on mute.
Sorry, my dog was barking, and I even have my dog outside, and my dog was barking. So everybody who's ever talked to me on the phone knows that I have a big fluffy dog. So sorry about that, guys. Sorry. So can a PTA, if permitted by state laws, Mary, treat Medicare patients if there is direct supervision with co-signature of the PT during COVID, making sure patients can get care if shorthanded? Or are the rules the same as if students treating the patient?
Are you talking about telehealth supervision? They have certainly made some allowances for telehealth supervision, but it doesn't mean if you're in a private practice. Now, in a rehab agency, general supervision, so the PT doesn't have to be there on site, but they have made some telehealth provisions to allow for supervision that way. But it doesn't mean that you can just go out and treat the patient under general supervision in the clinic, which we wanted them, at least I haven't seen it, we did want them to say that, because when you're dealing with capacity issues, social distancing and whatever, it makes sense. But I have not seen that formally put in language.
And so now I'm going to ask that question the exact same, but I'm going to say, can a PTLA, licensed applicant, treat the same as, do you want me to just re-ask this question? Can a PTLA, if permitted by state laws, treat Medicare patients if there is direct supervision with co-signature, et cetera?
A license, what are you saying?
PTLA. Erica, you may have to explain this a little better. I'm not sure that we're following this. PTLA, licensed applicant.
Oh, not Medicare. Medicare requires that you be licensed and that you have an MPI. So if you're a private practice, so no. If it is a commercial patient, it depends upon state law whether they allow an applicant to treat patients, and in most cases that's going to be on-site supervision.
Okay, thank you. Teresa, the FFCRA covered time is still reimbursed by the government to cover the 2/3 of the salary, right? We've been taking the credit when paying our payroll taxes deposits bi-weekly.
Yes, there are still tax credits available for money you pay out under FFCRA. The IRS on their website has information on how to go about getting that tax credit back. But yes, it is absolutely a one-for-one tax credit. The money you pay out does come back to you as a tax credit.
Awesome. Love hearing that. Okay.
Yeah, a win finally. So.
Right, I know, right? So hold on. I had this one open and then I messed it up. Okay. So I'm reviewing, this is somebody who obviously has our program, the EHS manual, and we need to offer TB testing and HB testing with the employee paying the cost for the testing. Oh, sorry, with the employer paying the cost for the testing. Can we make the choice as an employer to have the employee cover the testing costs, but still be a requirement to work at our business? Is it a state or federal law
First
guidance?
of all, we're supposed to limit this to COVID, but I'm going to address that because it happens a lot. You are required by law under the bloodborne pathogen standards, which applies to all of us, to offer the hepatitis B inoculation at no charge, and that includes the time for testing for get the inoculation. So you don't have a choice. They can decline. In the early 90s, when this came into effect, people were not inoculated. So you had to, you usually had people that elected to have it. Now we have a lot of people electing not to have it because they've already had it, because schools require it. They do it, pediatric inoculations and all those types of things. PT schools require it, so we have less. They have the right to decline, but they have the right to change their mind. They have the right to ask for a titer. You must pay for it all. TB is a different story. TB, the information in our environmental health and safety manual states that it is a CDC recommendation. And so the TB test really, firstly, they recommend that you test new employees, and then they recommend that you do risk assessments on everyone else and that you do those annually. Whether you have TB testing for all of your employees really could be dependent upon your risk level. So if you have a high TB rate in your community, in your state, most likely it would be wise to do the TB testing. Can you request they pay for it? I would tell you that would be a very imprudent move on your part if you're requiring. I can't tell you that you get your hand slapped. I'd probably talk to the Department of Public Health about that in your area, and always annually check your risk level for TB.
Okay, thank you. Okay, all right, so this is our last question in queue right now. Hold on, it's an HR question, Teresa. We're a small physical therapy company. When COVID shutdowns began in March, we converted all of our professional staff to hourly. Most were furloughed and then reintegrated. Out of habit, we never got them to punching a time clock like our hourly employees. This is complicated, but the fact that many of the professional staff do documentation after hours, which is considered part of their regular job duties. We cannot afford to pay them overtime for these duties. Can we just insist that all documentation performed within the regular 40-hour work week? Is that possible?
It is possible, as long as you're allowing them documentation time during their day that's reasonable. You can have a policy in place that says overtime is not allowed without prior approval. So, work is expected to get done in the 40-hour work week. If someone comes to you in advance and says, I have 15 notes and I've not had more than a 5-minute break in 4 days, I'm going to have to work overtime, to finish my notes, then they have the opportunity to have that approved, based on what's happened in the week. Then if somebody works overtime and doesn't have to be approved, you can write them up for violating the overtime policy and discipline them from there. And the other option here would be to, if you brought them back off of a furlough and they're back full-time employees and they're PTs, you could bring them back on as exempt staff like they were before. So they're licensed PTs, here's their new salary, and it could be different than what they were making before, but here's their salary, they're considered exempt, their salary would remain the same every week. There would be no overtime because they would meet the criteria for exempt. So kind of two options there, depending on how you wanted to handle your staff going forward.
So Teresa, to clarify, you can be exempt and hourly. You don't, the difference being you're not getting overtime.
You can meet the criteria for exempt, and you can still, as an employer, choose to pay everyone hourly and have everybody as non-exempt. That's fine. You can totally do that. But know that if they are working more than 40 hours, if you've made that decision, they are eligible for overtime for any hour over 40, or if you're in one of the states that has a daily limit, any amount over the daily limit, if that applies.
Awesome. Okay, guys. Well, all of our attendees, are there any other questions that you guys want to ask?
Alicia, I had one that came in.
Oh, you did? Okay, sure.
Yeah, and actually I had a couple, but this one I want to particularly answer because I think this is on people's mind. And remember when I told you a lot of things are happening because people feel like they have a hazardous environment. So whether it's OSHA or workers' comp or whatever, and this one says, can I file a workers' comp claim if I feel my exposure to COVID was work related? And it's interesting because right now there were 31 states as of the end of August who enacted or attempted to enact legislation relating to COVID and work-related claims. 5 of those failed. If you want the list, it's certainly available on the web. We have the link available to you, but it is something that is occurring. And I think Teresa and I talked about this the other day. We're seeing more of this, but as of the end of August, we were looking at 31 states who took the initiative. And the other thing too is, my question would be, if the state doesn't have the law, you're going to have to prove some things, and you're going to have to prove that you did comply with the existing PPE, screening, all those types of things. You're going to have to prove that the facility did not comply with recommendations from CDC for social distancing, all of those things. So I think it's important for people to understand, yes, they do have their right if the state enacted legislation, but they're going to have to prove a lot of things if they didn't.
Okay, awesome. And I just saw a couple more pop up. Sorry guys, trying to navigate 3 different screens here.
We know we're multitasking.
Yeah, so that's why I keep looking over here, everybody. So I'm not like looking at some other person in the room. I'm looking at another screen. I'm in an at-will state, which means I can fire someone anytime, correct? This is a Teresa question.
Yeah. We love this one.
Actually get this a lot. Technically, yes, you can fire someone for wearing a purple shirt on a Thursday, just because. However, that does not protect you from a wrongful termination, an EEOC claim, or an unemployment claim. So if you fired someone and they feel they have a claim for any of those things, you wrongfully terminated them, they were being discriminated against because they're, male or female, or part of an ethnic group or a religious group, or, any of those things, you could be at risk for a complaint or a lawsuit. In addition to that, without proper documentation, firing somebody probably makes them eligible for unemployment. So unemployment chargebacks ultimately impact your unemployment tax rate. So you want to keep in mind that just blanket firing people is maybe not the way to go. Document what's happened, give somebody an opportunity to improve. Depending on the situation, there are going to be some situations where terminating someone for cause is the right first step, but you still want to document what happened and have that. So when you file an unemployment, when they file unemployment and you have to defend it, or they file an EEOC claim and you have to, you get that paperwork and you're like, oof, now what? You can share the documentation you have. Here's what happened, and your practice will be protected. So yes and no. Yes, you can. No, we don't recommend it, and that's why.
Okay, got it. And then another HR question. We made changes to our PTO policy because of our reduced income and suspended accrual. So that stuff, is this allowed?
So you can make changes to your PTO policy. There is actually no federal law that grants vacation time or hours for employees. However, there are 18 states that have mandated sick leave accrual. So if you're suspending your PTO program and you're not keeping your sick leave separate, you do need to make sure that during that suspended time, you are still accruing sick leave at the state mandated rate if you're in one of those states. So District of Columbia, if you're in Arizona, California, Connecticut, Illinois, Maine, Maryland, Massachusetts, Michigan, and Montana, or Minnesota, excuse me, not Montana, all the M's, Mays, Nevada, New Jersey, New York, Oregon, Pennsylvania, Rhode Island, Texas, Vermont, and Washington. So any of those states, you have state mandated sick leave at some level, either at the city or county level or at the state level. So be aware of that if you're making changes to your PTO policy, and always, always have your PTO policy in writing and any changes in writing. Make sure your staff are aware, make sure you've informed everybody, and make sure you're keeping track of the accrual appropriately.
Okay. All right, Mary, I know that you were looking at some that were emailed to you. Are there any other questions?
Yes, so I'm trying to see. I have one. This one says, we have an employee who's been in contact with a patient who tested positive. The employee at this point is asymptomatic, but they went to their doctor because they were concerned, and the doctor said, "You're asymptomatic, I'm not going to approve testing." What can they do? And basically what CDC said as of August 24th is people who should get tested. So I don't know if they can bring that to the doctor, or if you change doctors, or you call Department of Public Health, but it says people with symptoms, okay, well, they don't qualify. People who have had close contact within 6 feet of the infected person for at least 15 minutes, so that's that social distancing and close contact thing, and people who have been asked or are referred to get testing by their employer. So those are things people need to consider. If you do have a physician who tends to say, you're asymptomatic, you're not a problem, because we do know that is an issue. They have proven that asymptomatic people carry about the same amount of virus in their nasal passageway as symptomatic people, if they are positive with no symptoms. I had another one.
I have two more actually.
Okay, go ahead.
So let's see, let me make sure I'm reading the whole thing. So you can't double dip, and this has to do with workers' comp and paid sick leave. Workers' comp, paid sick leave, or unemployment, when an employee is claiming something, they can't double dip on any of those, correct?
Correct. Workers' comp pays them or not because it's a work-related injury. Unemployment pays them if they're not working. I know what was the other one?
Paid sick leave.
Paid sick leave would be they're still employed and they're just using sick time. So they wouldn't be eligible for unemployment because they're still at work. They're just using paid sick leave. There will be some employees that try to work the system. So if they are on sick leave but filed unemployment, for example, when the employment paperwork comes in, be sure you fill it out and indicate the employee is still at work, because then their claim will get denied. And I just want to add one more thing too. When I was talking about all of the leave for our friends in New York State, New York State has an additional sick leave policy specific to COVID-19 above the Families First Act. So if you are in New York, be aware of that. And if you have questions, let us know. But just, they have an additional sick leave above their sick leave accrual for the state level, above the Families First, specific for COVID. So they have a bonus set of leave in New York.
So Mary, how long after an employee is in contact with a positive COVID person should they wait to get tested for the test to be accurate?
The question of the year, unfortunately, and I actually looked this matter up today to see if there was anything more coming. So the researchers are not saying they have an absolute, but because incubation period typically from exposure is 3 to 14 days, you'd say, well, then somewhere in that. But the average exhibition of symptoms is 4 to 5 days. So you go, okay, so what do we do? And when I looked it up, I looked on WHO, also the World Health Organization. They were talking about pre-symptomatic people. That's a new, they're kind of moving that one in. It's not asymptomatic or pre-symptomatic. They can be pre-symptomatic 1 to 3 days before all of a sudden they get symptoms. So you have to look at all these factors, and what I will share with you is that if a person is known to have been exposed to COVID, they could be contagious 48 to 72 hours before starting symptoms. So most likely they should not get tested before 72 hours. If you wait to that average of 4 to 5 days, did I say hours? Yeah, that was hours. But if you wait to the average symptom demonstration, 5 days into, quarantine, so it's really hard. It's really hard. That's why social distancing, proper PPE, all of that is so critical.
Okay. And I believe, unless Mary, you've got another from your email, I believe that was the last question that we had in queue and that's been here. Is there any other questions from any of our, I can see we've got a good number of clients on this call, so thank you, first of all, for attending. And then also would love to hear feedback if you thought that this was valuable, if you want us to do more of these types of things, you know, other topics.
Time frame, dates and time.
Yeah, date, hours of the day, what's better, things like that. So again, this was recorded and it's also on our Facebook page. So if you ever want to go and see it, you can go to our Facebook page and it will be there. If you are not a client, I did put a hyperlink in the chat box. We have got some good takeaways, giveaways. We have some exactly how to do an ADR. So exactly how to, you know, if you get one, what you're supposed to do. We also have some HR resources, you know, the exempt, non-exempt stuff. We've got a decent amount of things that are in there that are free that you guys can go in and access. And then if you want to learn more about what BCMS does, certainly you'll be able to find contact information on that website link. So thank you. Oh, sorry, go on.
Can I do a non-political paid announcement, unpaid announcement?
Yes.
I will tell you, most of our people, our clients certainly received our emergency preparation and prevention action plan. This is an extensive document that is very customizable. It doesn't take a whole lot of thought process. You can eliminate things, add things that you have done. Right now, we have 16 states who have mandated this, okay? Again, we have that list for you if you need it. We have another 10 who are considering it and highly recommend at this point, outside of an executive order, to do it. I would encourage everyone to initiate it. We have, it's a very, very nice plan, but you really want to take some action. You want to record what you have done to prevent and protect, and what you plan to do to continue in compliance. So very, very important for you to look at it. There may be other sources out there, but we certainly would like to be your source if you're not a client already.
All right, thank you, Mary. And I'm sorry, that was actually in the queue, so I'm not sure how I missed that one because I recognized the you know, question itself. For clients, we did send this out in the SIPA. If you don't know where it is or can't find it, you obviously can email me and we'll point you in the right direction. But if you're familiar with the portal, it's located under the Environment, Health, and Safety forms, and it's going to be directly in that area, and it's very clearly spelled out.
It's listed under that title, and it has all of the exhibits, which are on your support. There's 17 support documents for you.
Yes, yes. Mary loves exhibits. It was super fun.
You had to link all of those.
I had to link all of them.